Steps of a stranger, you'll learn things you never knew you never knew. And then Tarzan, who reminds us, why are we threatened by anyone who looks different than us? These all quotes are related to being client-centered and not discriminating. So that's why I chose some of these, because I think they're relevant. Okay, now just a quick update on maternity. I know we're going to go over a few minutes. We did this morning too, but we're going to streamline the rest of this. Just so you know, we are bringing maternity back, which is near and dear to my heart, and I'm very excited about. Districts 7 and 9 have very active maternity clinics. District 8 had an active clinic that will resume after their new staff are oriented. We have some districts that are starting soon and some districts that are starting after the first of the year, but pretty soon we'll have maternity services in all the districts again, and that makes me so excited. And as far as maternity goes, the medications and supplies for maternity are restricted to only those sites providing maternity services. So they can be ordered for both brick and mortar and the mobile unit site. So if you're adding services anywhere, you need to let me know, and I'll tell the pharmacy staff so that they will fill orders when you submit them. Otherwise, if you order maternity items and you're not on the list, then they won't send them to you. And just as a reminder, I think we've already mentioned this today, but we provide prenatal care for the uninsured, underinsured, those with private insurance, Champus, TRICARE, Medicaid, anybody that comes to us for services. And if the services aren't covered by one of the third-party payers, then the Title V funds or the State Maternal Health Innovation Grant funds will cover the cost of services. An evaluation component is being tested and piloted right now by a couple of our practitioners. And so those of you that are adding maternity services soon, that should be ready for you, but we do have to report data to the grants. And so we do need the evaluation component. And I don't have time to tell you, but I just know after our conversation yesterday with the maternity providers that our clients are definitely not low risk. They have a lot of risk factors, and our services are definitely needed. Now I'm going to hand it over to Misty, who's going to talk to you about child health for a few minutes.
Okay, hello, everyone. For those of you who have not met yet, my name is Misty Hammonds, and I'm the Child Health Nurse Practitioner Consultant in the Central Office, and I have some important updates about child health. So we currently have 7 child health nurse practitioners participating in the pilot for child health services funded by the Title V MCH block grant. And a couple reminders about sports physicals. Best practice is to complete the sports physicals during the well child exam. Sports physicals as standalone visits cannot be billed to Medicaid or Sooner Care. If you are seeing a child in clinic and you complete the sports physical form during the well child exam, but you need to do that in addition to the Bright Futures forms for well child visits. Sooner Care only pays for well child exams. However, we know that some of you provide mass sports physicals in the summer, early fall, and we know it's not practical to do a full well child exam during those events, so it does not apply there. Also remember, all physicals given for OSSAA participation must be given no earlier than May 1st of the preceding year in which the students are to participate, and before the first day of practice in that student's particular sport. So for example, if you did a sports physical in December for a student playing spring golf and the student plans to play football in the fall, then they'll have to come back after May 1st for the fall sports physical. And an exciting announcement, we are partnering with school nurses, school districts across the state to provide access to child health services. I have to give Gail Black a shout out for making this happen. It was her idea. So this will mirror the same child health practices as brick and mortar county health department clinics, bringing the mobile unit to the schools. The child health nurse practitioners will provide well child, sick visits, as well as immunizations. Private insurance or Medicaid will be billed when we can, but there will be no out-of-pocket cost to families. And then parents or guardians should be present for the visit in most circumstances. District 7 was the first to quickly join us on this opportunity. So far, District 7 has had great success working with both Dahlonega and Webbers Falls Public Schools. I know there's also been some discussion with District 8. Both Ardmore and Ada City Public Schools are interested in getting this started as well. And we have a new nurse practitioner starting in District 5 on the mobile unit, and Gail is working to find schools for them to partner with. This partnership is an opportunity to reach out to children with limited access to healthcare, keeping them healthy and in our schools. So please reach out if any of you want to get this started in your districts. And a little bit about site visits and the chart reviews for child health. Those plan to start next year around the spring of 2023. I'll have more information to come about that, but these are to assure charts and visits are meeting program guidelines, and we want to make sure you have what you need in order to be successful. And moving on, the reach out and read applications, there's a link there. Just a reminder that the applications must be turned in before the 10th of the month for reach out and read. If you have not created an account for your site, you'll need to create an account for your child health brick and mortar sites and or mobile unit, including anyone who will be helping with child health clinic. So that includes nurse practitioners, nurses, clerks, they all need to be listed. Read and check the program compliance agreement, and then you'll need to upload a letter of support signed by your RAD. Once your application is approved for training, Lori Lake with Reach Out and Read will contact you. So I did a pediatric review session on childhood skin rashes a month ago. So I need suggestions for future sessions. So if there are topics you guys are interested in, reach out to me, send me an email or post on Teams. Speaking of the Teams page, there's a Bright Futures Child Health Clinics Teams page. For those of you that are in the pilot for child health, you should have access to this page. If you do not, let me know. That's where we'll post important updates, questions, and that's where you'll have access to the files with the training videos, pediatric reviews, Bright Futures forms, ASQ screeners, and promotional materials for your clinics. And just a few more things. Next slide. Thank you. So listed are the child health medications available from our formulary. So please prescribe from our inventory if possible. I know this is completely different from what Jill told you to do for family planning and maternity. So this just applies to child health. Try to use our medications, especially the ones that are about to expire, instead of writing a prescription. Highlighted in yellow are the ones expiring soon. And then in red are low inventory items. For the azithromycin 1 gram powder, we did reorder that because it seems like that is being used. But the clindamycin topical solution at the bottom of the list, we decided to hold on reordering because the inventory we have, we can use the erythromycin topical solution as an alternative. And then as far as the medications we have available, any feedback would be helpful. So this is still a pilot, adjustments can be made. So for the providers, I want to know what you would like added to our formulary or what we could do without. You can send me an email or, call me on Teams and we can chat about it. I also wanted to mention about the permethrin cream for treating scabies. It's recommended to treat those living in the same household at the same time. So it's okay to use from our formulary for family members in that situation. Listed on the slide as well are the child health supplies. So the practitioner should have all the supplies listed except the pediatric blood pressure cuffs. Those have been ordered, but they're not in yet. So I'll post updates on Teams when to expect that. And if you guys are low on medicine cups, I can send you a couple more sleeves. And if you're getting low on sterile water, reminder to let me know and I'll send you more. And then we'll need to reorder them. But that's all the child health updates I have for today.
All right, thanks, Misty.
Thanks.
I just have a couple more things to cover real quickly. We have updated some forms during this year. So the family planning form, as I'm sure that you all know by now, we replaced 393 and 876 that were family planning forms with the 1423 and 1424, which are the forms that we use for all of our visits now.
So I'll give
we also,
your presentations naturally.
okay, well, you know what? I can't figure out what keeps changing this afternoon, so I'm just gonna say you have the presentation that was sent out to you, and you can look at that presentation. Let me stop sharing. Let's see. If you can't see it, there's no point in sharing it. Did it stop sharing now?
Yes.
Okay. So, and we also added the preconception tool, which originally didn't have a number on it, and then we added a number on it when I realized that the forms committee was still functional. And then we updated a few of the other forms. So if they're on the list, make sure that you have the ones that were dated from either 2021 or 2022 that are on the PowerPoint. And these have all gone out with the memo. And then on the maternity forms, we created the quad screen. Thank you, Kamisha. We created the quad screen informed consent form this year, and we updated the P474 maternity services fact sheet with the client signature. And then you can go on to the manual updates. We had quite a few manual updates. Family planning manual section C was updated to reflect changes from the final ruling, Title 10 ruling, and to be able to give negative HIV results over the phone. Some of these agency policies changed a while back, and we just got sidetracked with COVID and everything and didn't get all the manual sections updated, so we're catching up. The records and forms section was updated with some minor changes that we found during annual reviews. The methods of contraception was updated to reflect the changes in the efficacy of Mirena and Liletta. And we added information on screening for victimization. The financial management section was updated to match the changes that we had done to the maternity manual. And the sexually transmitted infections section was updated to match the guidelines that were in the CDC guidelines and also the physician approved protocols. So, oh yeah, we would have missed my last two Disney quotes for you. So the last two thoughts that I have to leave you with are, it's up to you how far you'll go. If you don't try, you'll never know. And then one of my favorite sayings from the Lorax is, unless someone like you cares a whole awful lot, nothing is going to get better. It's not. And I know that I think we have a fabulous team of people working together. I know that our programs are not the only programs that you work on. And so I want to thank you for the time that you take to make the MCH program successful. And know that sometimes during these presentations, we focus on the things that we could do better on, but you're doing so many fabulous things out in the counties that we really look to come out on the comprehensive programs reviews and see the teamwork that you have out there and then the great things that you're doing. So again, I just want to say thank you.
All right. If you have any questions about information that was presented, you may unmute your mics at this time or place it in the chat. There's a lot of thank yous that's on that for the information and wonderful team. Right. Seeing no hands raised or any information on the chat, I'll turn it back over to Ira at this time.
Just a quick update. I put it in the chat, but as of now, we've had about 300 and what was the numbers? 331 to 335 sign-in sheets that people have submitted via the QR code or the hyperlink thank you very much for getting your information in. I will be sending out the stats to each of the DNMs or the DNM equivalent at the contract agencies after the meeting. Just a reminder that future training dates include November 10th, 2022, the Community Participation, Outreach Strategies, and Quality Improvement. This will be a recording that Kamisha and I will be making for this video conference training. Also, we will be scheduling meetings with each region to work on the 2023 community participation plans during November and December. DNMs, please be on the lookout for a link to schedule your meeting. Thank you and have a great weekend.